is a one-stop hearing healthcare center that focuses on diagnostic and management of hearing disorder. We offer a complete range of hearing products and solutions for both our adult and children. We strive to provide professional and personalized hearing services by our trained audiologists. Our goal is to promote hearing healthcare as a part of healthy lifestyle, and our services include comprehensive hearing tests, hearing loss, tinnitus rehabilitation, and hearing aids related services such as prescription, fitting, tuning, servicing, and etc.
My name is Aliyah Ching. I'm founder and chief audiologist of Soundlife Hearing. I'm a believer of better hearing, better life. Living in a world of sound can definitely transform a person's lifestyle and personality.
In Soundlife, we are all certified audiologists, where we follow the best audiological practice in order to help our clients to rehabilitate their hearing-related difficulties. Soundlife Hearing was founded in 2016. All the operation management and clinical tasks are run by a team of passionate and qualified audiologists. We carry different brands of hearing aids and few other health products to fulfill the requirement and need of our clients.
We felt the most joy when we see the transformation of a patient's life. It's amazing to see how much joy one can achieve through better hearing.
My life is much better now with my new pair of hearing aids. I can FaceTime call to my children, and so much better than last time that I can't.
Of course, Soundlife was the one that actually helped me to improve my hearing. My hearing impairment improved tremendously, and I'm very satisfied with that.
Our mission is to provide hearing healthcare as a part of healthy lifestyle, to raise hearing awareness of the public, to remove stigma of the society towards the hearing impaired, and most importantly, to empower people who suffer from hearing loss to live to the fullest with the latest hearing aids or cochlear implants.
Here at Soundlife Hearing, we are focused not only helping you to hear better, we help you through all the aspects of your hearing health. If you have any questions about your hearing, contact us and schedule an appointment today.
Imagine living in a world without sound, where the faintest sound is a lightning bolt. There was the life of my grandmother, who was diagnosed with severe to profound hearing loss. During the last years of her life, we used to yell at her all the time because she couldn't hear us. Over the next few years, she gave up watching TV and eventually even stopped trying to talk to us. She left the world with loneliness because she had zero communication with all of us in the last 2 years of her life. That was one of the saddest memories I can never forget. This personal experience changed my perception of hearing loss. I see that sound is not just about hearing, it's about personal connection. Now that I'm an audiologist, my aim is to restore personal connection back with loved ones through hearing loss restoration.
Good evening, everyone. Hi. This is Aliyah Ching, audiologist and founder from Soundlife Hearing. Today, we are very honored to invite Dr. Gan, ENT Surgeon, to actually share with us about vertigo causes and treatments. So he will actually share the overview about vertigo. So many people have actually suffered from vertigo, which is a dizziness, the spinning sensation. So let's hear from Dr. Gan. Hi, Dr. Gan. Hi.
Good
How
evening, everyone. Yes,
Okay.
I'm Dr. Gan here from the Columbia Asia ENT consultant from the Columbia Asia Hospital, Petaling Jaya. Yeah, good evening, everyone. Yeah, it's very honored to be invited by Aliyah to the live. Yeah, this is not our first time. Anyway, yeah, we talked
Yes.
about the hearing before, about the ear, how to take care of the ear. Well, now we change to a topic, which is the neighbors of the hearing, is the vestibular system, which is the involving the balance. Yeah, I think this is very important because in Mandarin, people saying 耳水, is basically the balance organ. Yeah.
Correct, doctor. So, doctor, just want to ask you, because may I know before we start, may I know usually how many patients that you see in your clinic they are having this here the vertigo problem?
Well, actually, almost if put it in a week, I will see estimate about 3 to 4 patients with a vertigo.
Mm-hmm.
So some are truly vertigo, some may be just pening, giddiness, it's a different perception. But when we see a patient with vertigo, we have to be very, focused because basically anything can cause vertigo. A lot of things can cause vertigo. That's why when people refer to us, we have to rule out a lot of things. We will talk more in details, in the coming session.
Okay, sure. That is good. So, doctor, do you mind to share with us? I would like to know. I think the audience here also would like to know that what is actually vertigo. Okay. So, do you mind to actually answer our audience here?
Yes. Okay. So if when come to vertigo, you see a lot of people talking about vertigo, but is it a true vertigo or not? So at first, when we want to know vertigo or not, we have to know the definition, isn't it? So in Malay, actually, there are so many definitions about vertigo. Actually, it's not only in Malaysia, throughout the world. This vertigo, you see, in different languages, different meaning, you see. Like people say, pitam, pening, pusing, all these carrying a different meanings. Another one is like lawyer, berat kepala,
Mm,
even in English, dizziness, giddiness, imbalance, sense of imbalance,
mm,
But what is true vertigo? True vertigo is actually a feeling of spinning, spin. Uh, then the sensation of the motion when in actually there's no motion occurring, you see, means this motion, the spinning is either you spin around in relative to the environment or the environment is spinning around you like a twister. Okay,
mm,
this is the true vertigo. But when
mm,
we come to balance, let's say, okay, before that, let me talk about this balance. Balance is actually a very complex thing, in our body system. Can you imagine if a person cannot balance himself, or
mm,
how the person going to work, to function in the daily activities, right? So this is a group of the effort by the eyes, we need the vision, by our ear, the inner ear, then by our joint. There's a sense of position, and also our muscle to balance it. If we want to fall to the left, then our muscle will, pull us to the right, so to get us the balance. Okay, this is basically a brief idea for you. Uh, Imbalance is not only a problem of the ear. It can be due to the vision. It can be due to the joint problem. It can be due to the muscles. Okay, and the worst, it can be due to the our brain, right? So disequilibrium, what is the disequilibrium means? It's a feeling of imbalance without a sense of spinning. You see, this is different. Like vertigo is a spinning, but this one is without the spinning, but the sense of imbalance. This is like we are in a boat, right? It's like floating kind of sensation. Okay, syncope,
mm,
people say about syncope. Syncope is different meaning again. Syncope means the patient will lost conscious. Like, there's initially with some imbalance, then the person suddenly they just fall down. Then you lost conscious. Okay, these are the few definition, the things that differentiate among the true vertigo and the non-vertigo. Okay.
Well, doctor, I would say that as an audiologist, even though I already learned the theory of vertigo, but
Yeah.
by just listening of you explaining the true vertigo and the non-true vertigo, I also get confused a little bit. So correct me if I'm wrong, because I think there is also many audience here. So maybe they also come in a bit late. I can see that now our audience are getting more. So feel free to say hi to Dr. Gan and myself and tell us where are you coming from, how do you know about us today. So today we are actually talking the topic about vertigo causes and treatment from the ENT's perspective. Okay, so just now Dr. Gan have mentioned that vertigo, the true vertigo is actually the spinning sensation that the patient feel. However, by in actual fact, actually the room and everything is stationary, but the person feel the spinning sensation. Am I right, Dr. Gan?
Yes, yes.
Yes.
Alina, you learn very fast.
Okay, thank you. So, but of course, I would like to just now you also mentioned that vertigo is also an integrated. Sorry, actually, it's not vertigo. It's a balance system. It's also integrated between the eyes and the ears, and also our how to say the
The joints,
proprietary, the normal, the
the
physical.
proprioception.
Yeah, so integrated of this system. So all these three systems must work well in order for the person to have a perfect eyesight stationally, and you don't really feel the sensation of vertigo, right,
This is
doctor?
this is especially true, right? If you are
Mm,
standing, you close your eyes, you raise your hand, you know you are raising the hand, isn't it? Ah,
yes.
do you think this anything related to the ear? Of course, it's not, isn't it? Yeah,
Mm,
it's a sense of position. That is
mm,
very important to keep us balanced on our
mm,
feet. Okay, so that's why it involves the joint, involve the muscle. People with a joint problem, the knee problem, you see, when they walk, also feel like like falling towards one side or left side, left or right, Yeah, if people with a weak muscle, they are always, like those elders who are bedridden. You ask them to stand up and walk, they cannot because their muscle is too weak. That
mm,
can cause them a sense of imbalance as well. So a person with a heart issue, yeah,
mm,
you see, yeah, when they lie down, suddenly they sit up, oh, they feel spinning. Why? Because of the heart issue, they need to pump more blood towards the brain. You see, so this is quite complex, isn't it? I think when we talk more, you'll get more confused. Doctor, is this anything related to the ear? So now you understand. Every day I see people like with a vertigo. I really, really have to make sure, does they really have a vertigo, or is it the vertigo is just a sense of imbalance due to maybe the eyesight problem, maybe just a refractive errors, you see, just like the patient, suddenly, you got a refractive error, become a short-sighted or long-sighted. That's why they cannot see clearly. That's why they have that kind of sense of imbalance, right?
mm.
That's why the true vertigo and the non-vertigo per se, I mean the general sense of imbalance, we really have to differentiate it well.
Mm, I see. So, doctor, do you mind that I ask? Usually, who is the person who are more prone to get this vertigo problem? Is that an age group, or like is it more happen to the woman or the guys?
Okay, actually, when you look at the incidence of vertigo, if you ask any friends of you, surrounding friends, anyone have a history of the vertigo attack in their lifetime, it's
Mm-hmm.
actually quite common, no? Okay, it's actually quite common. But if let's say we talk about what, be it a vertigo or dizziness, there are about 20 to 30% of the general population may have this vertigo or dizziness, throughout in their lifetime. Okay, and in the US, actually they have this kind of study. Okay, accounted about 2.5% of this ED. ED means emergency visit, emergency department visits. Okay,
Mm,
it account about 2.5% of those people who come to the ED is anything related to vertigo. So the
mm,
1 year prevalence of vertigo is about 5%, and the annual incidence is about 1.4%. So when talk about the sex, actually it depends, because the vertigo is actually just a symptoms. It's not a
mm,
disease per se. You see, a lot of things can cause vertigo. Uh, Let us just focus in the ear. Okay, it can be due to positional vertigo, can be due to and the nerve inflammation. The nerve that transmit the information or the balance to the brain.
mm-hmm.
The vertigo, or it can be due to the Meniere's disease, can be due to the medication. Yeah, later we will talk more about in details about all this. That's why it depends. But in general, it's more common in females, Aliyah. Yeah, it's more common in females. Yeah, even
Okay.
pregnancy as well. Yeah, it can happen in pregnancy as well. And
Yeah, yeah.
mm,
Yeah, I actually come across an article mentioned that a pregnant woman is actually prone to have this vertigo also. So other
yeah,
than the pregnant woman, how about elderly? Because doctor, as you know that for Sound Life, more than 50% of our patient age group is above 60 years old. So I think that over here we also have some of our patient is from listening to our live, and then we would like to know lah, what happened? How about the elderly? Because a lot of elderly also come in my clinic and they tend to say that yawa, so it's like sometimes one meaning is like burning now or dizziness but sometimes it's also for us we also feel that very hard to differentiate, and especially when during the case history we will ask that whether the patient have any ringing inside the ear, the hearing loss, how bad, and also any vertigo history. Yeah, so sometimes some of them just say that I don't have vertigo history, but I always get headache, I always get dizziness, so greediness some more. So doctor, how would you recommend or advise for this part? Are
yes.
they actually part of vertigo or no?
Remember about the definition of vertigo? Uh,
Yeah.
the, the spinning. There is a word, the key word about to differentiate the those vertigo and non-vertigo. Okay, a true vertigo, the patient will spin. Either the patient spin or the surrounding spin, like a twister. Okay, yeah, this is quite uncommonly seen in elders. Okay, elders usually they are more towards like sense of imbalance. Remember, it can be due to the joint issue because of the osteoarthritis. It can be due to the weakness due to the osteoporosis also. The bone become brittle, then the muscle become weak. Okay, it can be due to the stiffening of the blood vessels. You see the positional, the vertigo is built due to it's not really a vertigo. I mean the dizziness when the elders they're sitting up from the lying down position. So if a true vertigo is actually more common in the age ranging from the 30 to 50 years old. This is the age that commonly happen. A true vertigo. Okay, so when we come to the vertigo per se, the most common vertigo, I mean, the ear related to the ear, is what we call a BPPV, a benign paroxysmal positional vertigo. Okay, benign means it can happen anytime. Or it actually accounted about 40% of all the vertigo cases. And the recurrence rate is actually quite high. It's about 50% in the 5 years time. That's why a person who experienced a true vertigo before, they may ex- they may experience a vertigo again, in their future. That's why we call a recurrence rate. Yeah. So elderly, elderlies for about the vertigo or sense of imbalance, this is actually very important topic because you know why most of the elders they fall, they fall because of the sense of imbalance, then they break their bone, then
Yeah.
they become bound. That's where the disaster starts, right? uh, that's why the balance, when you talk about balance, this is a really important. Okay, Aliyah, maybe you can show them about the anatomy of the ear so that we can actually have more idea
Yep.
that yeah what I'm talking about. Okay, so just have a brief idea. Okay, what we call the vestibular system. Vestibular system is the system, organ for the balance. Okay, so here we have a
Oh,
no.
sorry. Yeah.
Okay, in the ear we have three parts. This is the external part. External part means from the our pinna, into the ear canal, up to the eardrum. Okay, this part is the external part. Then come to the middle part, which is also an empty space, which are occupied by the ossicles, the bones, the smallest bones in our body. Okay, these are the smallest bone in our bodies, the stapes. Okay, all this is to transmit the sound from the external ear into our inner ear. Okay, it actually convert the mechanical sound wave into electrical impulses. When come to the inner ear, then you can see something is like the shell of the snail. Okay, this is cochlea. This is where the Aliyah expert in about hearing. Okay, but the neighbors of this cochlea, you can see the head of the snail. All right, this is what we call a semicircular canal. But basically, this is the vestibular organ, which are which control the balance. It also carry, it sends the balance by means of, the position. Let's say you close your eyes, you try to turn your head to the left, even say about 10 degree, you can sense it, right? You know, right? Your head is turning to the left 10 degree, isn't it? So means this organ is very, very, very sensitive, and the information that uh, carried by them to the brain, left and right, must be identical. You see, if there's any discrepancy between the these both part, the right and the left, that is when the vertigo start. So yeah, with this kind of anatomy, okay, you briefly or you roughly know, right? So how the balance work, and this information you see processed by this vestibule, the balance organ, where it goes, it will go through the nerve. Aliyah, you can have a next picture. Aliyah, can you hear me? Yeah, this one. So when you go into the deeper structures, okay, you can see the vestibule and the cochlea. It carry the nerve, okay, the nerve. In this case, you say they're saying that the inflammation of the vestibular nerve, they're carrying the information of balance to the brain, okay. So when this information carried to the brain, it will be integrated or interpreted by the brain about the position of our head, our neck, okay? Then it will integrate this information together with our small brain for the coordination of the hand movement and the leg movement, also to the spinal cord, that for the sensation of our leg, our hands, our bodies. You see, all this sense of position, okay, the muscle control, even the sensory, also together with the ear and our vision, all this will give us a brief system of the balance organs in our body. So roughly you understand, isn't it? And also the interesting part about this, you see, all this information is not only interpret in the brain. We are human, you see, we have feeling, isn't it? So it will go into our the hippocampus as well, into our limbic system. So means that when we are emotional, okay, either we very sad or we very happy, it actually can cause vertigo as well. The giddiness, the sense of imbalance, Oh, that's why even actually in the movie you saw, right, a lot, right, when they get sad, then they will suddenly just collapse, right? This is common, but actually it can happen, it can.
Okay, so doctor, are you saying that we have to be, how to say, well controlled with our emotion?
Yeah,
Don't get too
definitely.
happy, don't get too sad. Otherwise, it may also trigger the vertigo. This is the first time I heard about it.
Yes. When you understand what am I talking about, so then you will understand how to manage a person with vertigo. All these are very important aspect that people usually miss. Okay. So when a vertigo patient come into my clinic, the moment they come into my clinic, I will roughly know how serious or how bad is their condition. Let's say a vertigo patient just walk into my clinic. A vertigo patient, do you think it can walk? Yeah.
The
So
really serious one should be, how to say, cannot walk lah. Maybe on wheelchair,
see,
or people.
Adia,
Yeah.
this will come into the types of vertigo. Okay, there is one type of disease we call Meniere's disease. During the attack, it can last for hours. It can cause a very really disastrous. The person is basically like end of the world. You were screaming in panic, and vomit, and puke. Then he totally lost, he totally lost and very panicky. But after the attack, the person is exactly back to normal. It's exactly back to normal. You see, yeah. So this kind of person with vertigo, they can just walk into my clinic, but doesn't mean that their vertigo is not serious or severe. You see, but if a person need to be wheelchair into the clinic, then with a a plastic bag in front of them, I know this is during the acute attack, of the vertigo. You see,
Okay.
so that's why a patient with vertigo, if come to my clinic, there are so many things that I need to do. I have to assess whether this is a true vertigo or it can be due to other issues. You see, yeah. So
Okay. So, doctor, what is the just now you mentioned about few types lah. So just now, okay. I try to figure out here. I try to actually tell in front as on behalf of our audience here also lah. So doctor have mentioned there is different types of vertigo as well, and then but is it all the vertigo are coming from the ear? Because you do show us about this picture, the inner ear and the semicircular canals, which is the turn one. When we turn our head, something is moving inside so that it can stabilize our vision. And then there is also vestibular nerve. If something happened to our nerve, also can trigger the vertigo, right? So is that, can I say that all the vertigo are the inner ear problem?
Aliyah, this is a very good question. Okay. Yeah,
Okay.
that's how I mentioned about all the vertigo, and other the sense of imbalance, syncope, and disequilibrium, all that. So I think now you have a very brief idea what is a true vertigo. Okay, again, a true vertigo is a sense of spinning. Either you spin, the patient spin, or the surrounding spin like a twister. Okay, but in the reality, there's no spinning, there's no earthquake. You see, but just that the person is feel it. Okay, this is a true vertigo. Okay, a true vertigo doesn't mean all is related to the inner ear. It can be due to another issue. Okay, we call central vertigo. Central means our brain. Okay, so they are basically, if come to the vertigo, we divide into two types: the peripheral or the central types. Peripheral is due to the ear. Okay, in the peripheral type, as what I mentioned just now, the benign paroxysmal positional vertigo is the most common one. It account about 40% of all the vertigo cases. I mean the peripheral vertigo, or all the vertigo cases. Yeah. Vestibular neuritis, like just now I show, neuritis means the inflammation of the vestibular nerve. This nerve is the nerve that carrying the information in the inner ear or the semicircular canal to our brain. If this nerve, this is just like a TV wire, if the wire have something wrong, so it will bring the information inaccurately, okay, to the brain. So if this nerve get inflamed, it can cause a vertigo, and this type of vertigo is very severe. All right, the patient may have this kind of spinning sensation. It lasted more than 24 hours. Can you imagine if you just a spin, like you go for a roller coaster, you will vomit like, oh, very uneasy, isn't it? You will vomit.
Yeah.
But this patient, it may last 24 hours. It only can be stopped by medication. Sometimes. Yeah, they can sleep no more. Once they open their eyes, then it spin again. Okay, this is due to inflammation of the nerve carrying the information from the inner ear to the brain. We call it vestibular neuronitis. Okay.
Doctor, may I know this one how long it lasts?
Yeah, as what I mentioned just now, it can last about 24 hours or more,
Yeah.
more than a day. Okay, that's why it's very, very bad experience. I think for the person, you will feel like end of the world. Okay,
Wow.
right. Okay, the third type is actually the Meniere's disease. Meniere's disease is actually very rare. It's not common at all. It's about 0.5% of all the vertigo cases. And Meniere's disease, it involves not only the balance organs, it also involves the hearing organ as well. That's why in Meniere's disease, the person is not only having the vertigo, It may have some sound in the ear, either one side, and also reduction of the hearing. Okay, we call hearing loss in one side. In fact, if a regular attack of Meniere's disease, the vertigo like that, the patient may eventually go deaf in one side. So this disease is quite bad. All right. And the third and the fourth one, this one nowadays a lot of people actually taking a lot of supplements. Okay, be it vitamins or some other direct cells things. Actually, we have to be careful. Okay, not only these supplements, actually a lot of medication as well. Some high blood pressure medicine, blood thinning medicine, antibiotics, they can affect our organs. These hearing organs we call ototoxicity, mean toxic. Means these are drugs. Okay, it can actually attack our balance organs, causing the vertigo. It can attack our hearing organ, causing the hearing loss. Okay, yeah. Another type is what we call labyrinthine concussion. This happen for person who have say the car accidents or sudden head thrush. The thrush, boop, sudden move of the head. This is actually causing the vertigo for that kind of patient as well. Okay, when come to the central, just now we talking about all the peripheral, right? The central can be due to stroke. You see, that's why a vertigo patient came in. I really have to assess their movement, especially when they are on the wheelchair. I don't know whether they can move or not. Whether this is due to a stroke or what, or some intracranial, means the brain, inside the brain, some space occupying lesion, means some tumor or some growth in the brain. Okay, they suppress or compress on the surrounding structures. This can also cause a vertigo as well. Then another type is like the multiple sclerosis. It's a disease with in the brain. It can cause this kind of symptom as well. Sometimes can have hearing loss as well. Okay, then the cerebellar disorder means a small brain problem. Small brain is more for the coordination. When the coordination go haywire, so you can't really balance out. Okay, they can have this kind of true spinning. Okay, other causes. What are other causes? Like earlier, when we talk about vertigo, we cannot be too focused on vertigo, ear. It can have a very big picture. You see, not only the ear, okay, can have this kind of vertigo. As I mentioned, it can be due to the central, it can be due to the brain issue, but it can be due to other things. These other things usually is associated symptoms. Mean it's not really itself causing the vertigo per se. All right. For example, a person anemic, not enough blood. Okay, they can have this kind of disequilibrium, imbalance. Okay, sense of imbalance. You see, they may have syncope as well because their oxygen carrying capacity in their blood is not enough because of the hemoglobin level is low. Anxiety disorder, like what I mentioned just now, like anxiety disorder. It's emotional. A person become emotional, it can have this kind of burning episode. Okay, all these are the things that we have to look carefully. All right.
Wow. Okay, doctor. So I try to catching up. You just now mentioned that we are having the peripheral vertigo, right? Peripheral vertigo, which is like maybe could be something like BPPV, vestibular neuritis, Meniere disease, ototoxic drugs. These are the common cause. Common cause of the peripheral vertigo. And at the same time, we also have some central vertigo, which is happen outside the ear, but it's in the head, right? So could be something like the cerebrum,
Cerebellum, the small brain,
the small brain, yes,
the
and
small
also
brain.
some other parts which I cannot recall, but it's okay.
Stroke.
Okay,
The,
I would
the,
say
the,
that yeah, and also other associate symptoms as well lah. So I would like to see the audience feedback now. Okay, so doctor, there is one few people have say hi, so you can also feel free to look at the comment. So hi everyone, today we are having Sound Life is honored to invite Dr. Gan, the consultant ENT surgeon from Columbia Asia Hospital, Petaling Jaya, to actually came to our Sound Life hearing, and actually we are also co live stream with Columbia Asia together to share about today's topic, vertigo causes and treatment from the ENT perspective. So over here, doctor, there is few people who have a little bit of questions, but I think for the questions, a lot more need more answer to answer, need more time to answer one. I leave it to the back one. So Vinesberry, just hold on. Hope you can actually stay back and stay until the end of the live. And then there's one question people asking: is that the long term lack of sleep can cause vertigo?
Well, okay. So this answer is yes, yes. Okay. Um, when come to this vertigo, right? So it's a lot of associated symptoms. These kind of associated symptoms, right? What are them? One of it is the, you know, like what I mentioned just now, the osteoporosis, the muscle, the bone issue. Okay, lack of sleep actually can affect our, you know, the concentration, the focus. Okay, this lack of sleep also you can actually think about whether this is due to quality of sleep, whether quality of sleep or not. Do you really sleep well? You see, sleep is another topic. You see, it's very, it's something like vertigo. You see, anything if you are not feeling good, or you feel tired, or you feel giddy, you feel you cannot concentrate, you feel poor memories, you can all this you can actually blame to the sleep, isn't it? Not enough sleep, or the sleep quality is not good. But it cannot be the sole, I mean the only cause that causing your vertigo. All right, it can be a contributing factors. Contributing factors means it can actually worsen your vertigo. Okay, there's one of the treatment for the BPPV. Okay, BPPV means the benign paroxysmal positional vertigo. One of the treatment of it is sleep well. You have to sleep well. And also your sleep position as well. You know, the sleep position, because this BPPV, the vertigo can get worse when you lie down. You see, when you lie down, you can trigger, especially if you turn to the left, turn to the right, or even you look up or look down. You see, so the
Yeah.
position of your sleep can actually affect and triggers this vertigo. Okay, another another can be like even like vitamin D deficiency. You see, it actually also can cause this BPPV, the vertigo. Okay, but now let's talk about, come back to this vertigo. What are the things that
Yeah.
alarming you? You know, as alarming you, like the red flag. When you have these kind of symptoms, you will be more worried. Okay, you should get more worried. Okay, number one, it's a sudden onset. Okay, sudden onset means when you're walking or shopping in the shopping mall, suddenly, whoo, the vertigo attack. Without any reason. You see, without any reason, it just come like that. Okay, then the second things you have to see is the duration of the vertigo. Okay, the duration, how long it lasts. This actually telling us that the severity of the vertigo. Okay, it depends. It's not like the longer it spin means more severe. Okay, say about the BPPV again, it only lasted about few seconds. Then you will get back to normal. That kind of vertigo is actually very mild, okay, and benign, I would say. That's why it called BPPV. It's a benign thing. It recovers fast and it can be treated well. Okay. Like in the Meniere's disease, very severe, it's sudden onset, it come, but it can be just disappeared maybe after a few hours. That kind of vertigo also, it can be, we really need to aware about this, and maybe you have to tell yourself, well, I think it's better go to see a doctor to find out, rather than I Google myself and read, something like that. Okay, so there another symptom is a severe headache. Okay, severe headache. When a person have severe headache, okay, yeah, with vertigo, this doesn't ring a bell to you? Yeah, something it can be due to the central cause, you see, whether due to something in the brain, the space occupying lesion, means like a tumor in the brain or what, that causing the vertigo. This kind of things, then we have to think about central, means it's more serious type. Okay, this is another things that we need to be careful. Another symptom is not getting better. You see, if this is due to a peripheral vertigo, the person will get better when they rest. Okay, be it they see doctor or not, maybe they rest for a while, then they'll get better. This is also a very typical symptoms when patient present to my clinic. They will say that, doctor, this is not my first attack. This is actually my third time. But the first time is actually very brief. After I rest for a while, it just disappeared. So I thought nothing. Lah. The second episode, I went to the clinic, then they gave some medication, then it get better. But this round, I really cannot already because I start vomiting, I feel really uneasy. You see, this kind of symptoms and typical presentation is very common. Means it's getting worse, right? If that kind of vertigo getting longer and longer and it's not getting better at all, even when you rest, yeah, this is something that you should worry. Okay. And another one is the inability to walk. You see, as I mentioned to you, the vertigo, peripheral vertigo, it's not like persistent vertigo, you see. Okay. It's not persistent one. It will get better, right? When better, then you can work as normal. But if a person have to lie on the bed for days, cannot walk, something wrong, isn't it? If the vertigo persists, that affect the person's daily lives, and that is something that we need to really seek treatment. Or another one, this one is what I mentioned, is related to central again, means the person presented with some neurological deficit, means some nerve issue. The patient like weakness to one side, or the sensation, loss of sensation, or when he starts talking, it's very slur speech. Okay, they can't really talk well. All these were pointing towards the vertigo, the central vertigo. Okay, means the vertigo is probably not related to the ear, probably is from the brain. Okay, these are the few red flags or the warning signs that people have to be aware. Okay.
So, doctor, can I say that if let's say people who actually present the vertigo is like suddenly come, okay, and or like the duration of the vertigo is like not brief, it's actually quite long, as well as like some of them having some severe headache, and it's like not their first time having the vertigo, it's like multiple times, multiple attack, and even though they look at the GP and the GP medication doesn't help them to solve the problem permanently, or even some of them present with the symptoms with like not able to walk, or some neurological symptoms like slur speech or weakness from partial limb or whatever. So all this should actually go to see the ENT immediately. Can I say that we should advise
Um,
them go to the ER?
Yes,
Sorry,
yes, yes.
is it
During
a
the acute attack, usually patient is better to go to the emergency department because, like, if let's say it's present with some neurological symptoms, right? You do know maybe the patient blood pressure suddenly shoot up to 200 over 112 or 120. The diastolic, that kind of things. We need emergency management. So if they come to the clinic and wait for their turn to see a doctor, I think it may delay the treatment. You see, so any cases with vertigo, these are the things that the red flag, okay, the warning sign to telling them that they should seek medical attention as soon as possible. Okay, if during the attack, they should go to the emergency department. Okay, if they are okay in between but they feel worried because they have this kind of symptoms, they can come to the ENT clinic. Okay, the main things that I'm going to bring out here is they need medical attention, be it a general physician or ENT specialist. In a serious case, please go to the emergency department.
Doctor, may I know, some of my patients that I encounter, they do have this vertigo history, but maybe the history is already past few years, or maybe it's just recently, but the attack only come once in a while. It's not like every time. So if let's say they have seek the medical treatment before, and should they always go? Should they always need to go back to see the ENT, or actually they can be on their own maybe just prepare the medication that the ENT prescribed before, and then every time getting headache, getting the attack already, they somehow can tell. I got one patient say that, oh, when it is about to come, I know already. I quickly take the tablet.
Yes,
So,
Alia, this is what we call aura. Okay, aura. Aura. Aura means it's like you feel something. You got you feel like you have a sixth sense. You see, you know something is coming, right? That
okay.
kind of aura. This is a very typical presentation for a patient who's suffering from Meniere's disease. Okay, they have that kind of aura. Okay, feel like suddenly there is one patient of mine. Actually, she just recently saw me. She know when the vertigo want to attack. During when the vertigo is coming before the vertigo attack, like say about few minutes before, her ear will start ringing. That kind of sense, that kind of tinnitus. Then she will start spin. Then the next, if she not resting, then she will start vomiting again. Okay,
Okay.
and reduce hearing. All right. So this is what we call aura. But at first, no matter how, even though how mild is a vertigo, don't you think you want to know what's going on to you?
Yeah.
When a
So I
person with
think this also
vertigo,
leads to our next questions, which is how to diagnose vertigo. How doctor you diagnose vertigo? What kind of tests you are depending on?
vertigo is basically a clinical diagnosis. It's very important to get a correct history. Like what I told just now, a patient may have this history of vertigo before. At first, we have to know whether this is a true vertigo or not. Correct or not? Yeah. Then after that, we have to already go history in details, whether they took any medicine or not, whether they have any underlying disease. For example, like patient with diabetes. Yeah, when they close their eye, they say, oh, I can't stand well. Do you think that is vertigo? That can be due to the proprioception problem, means the sensation of the position problem. This is commonly seen in diabetic patient, high blood pressure patient, elderly. When they lie down, suddenly when they sit up, especially in the middle of the night, they want to go to the toilet. Oh, they sudden lost the balance. You see, yeah, that can be due to the high blood pressure or some heart problem. Okay, so all the history is very important. That's why a patient who came into my clinic with vertigo is really spend a lot of times. We have to find out what's going on, whether they recently they change their glasses or they never change their glasses for the past 10 years. Then something like that. It can be due to visual problem as well. So, but the vertigo is a symptoms. With the vertigo, we will go narrow down based on the history to the diagnosis. Okay, to confirm the diagnosis. Remember, Alia, the vertigo, the vestibular organ, is just neighbor to our hearing
Hearing.
organ.
Yep.
I think that is also the reason we are here today, isn't it? Yeah.
Yeah.
So the hearing. So the vertigo patient, very important, have to ask the patient whether do you have reduced hearing? Okay, do you have any sound in the ear? Okay, the hearing. So most of the time to confirm it. Okay, whether their hearing is normal or not, I will send to you. Okay, to the audiologist to confirm the diagnosis. That part of hearing test. Yeah, hearing test is important in patient with vertigo. Sometimes the patient may not complain, I have reduced hearing or what, but when they do the hearing test, we may detect, there's a mild hearing loss in one side or the high frequency or the low frequency. All these are important parameters for us to diagnose or to confirm this type of disease the patient is suffering from because of the vertigo. Okay, so another, it's like a blood test, you see. Again and again, when you see vertigo, it can be due to anemia, isn't it? So we need to do the check the patient's blood to see whether the patient is anemic or not. Okay. Then we need to check the patient blood sugar because of the diabetes. Check the patient renal function, the kidney function, the liver function. Okay. Whether there's any inflammation. Just now I saw a question, people asking, why the nerve get inflamed? Okay. The inflammation. Okay, this again is another topic. You see, inflammation is just a general term. Inflammation can be due to infection per se, can be due to infection, can be due to trauma, accidents. Okay, it can be due to infection. Infection also can be the bacteria, can be the virus, can be the fungus, or can be due to the parasite as well. Okay, bacteria infection of these hearing organs is very bad. The patient, the vertigo, this is what I call labyrinthitis. Okay, if it's just due to the nerve per se, it's very common. It's due to the virus. Okay, like the coronavirus causing the loss of smell. And in general, virus like nerve. Okay, so the viruses can attack the hearing organ just out of sudden. Wait, cannot hear. Okay, suddenly spin. Okay, this is due to the inflammation of the nerve. Okay, carrying the information balance to the brain. You see, it's like a roadblock there, blocking it from transferring the information to the brain. So how the brain know you are standing, sitting, or lying down, or that's why then the brain get confused. That is when you start spin. You see, now you get more information, diagnosis. So we have to take all the blood tests, all this, including the autoimmune disease. Okay, autoimmune disease, for example, uh, like like autoimmune disease, like this kind of SLE, actually it can cause the imbalance as well. So all the autoimmune diseases, we have to be careful. It can actually cause a lot of problem. Another infection, the bacteria infection like syphilis also can cause can attack this inner ear. So many things, you see. I
Yeah.
hope I hope I won't confuse you further. Okay.
So
So
very thank you, Dr. Gan, for the detailed explanation. So I'm not sure whether the audience not getting confused, but so sorry, doctor. I think my level is not good. I'm
okay,
getting confused.
this is not
But
end yet.
yeah,
This is just in the blood test, you see, to
wow.
diagnose. Other
Okay.
is like the thyroid. Yeah, another autoimmune disease like the thyroiditis. Thyroid is a very important organs that to keep us alive. The thyroid hormone. Yeah, this thyroiditis, the hypothyroidism means the thyroid hormone is low or hyper equal high. Also can actually affect the spinning as well. Okay, so the blood test for this. Then we come to the radiological, means a scan. X-ray. X-ray of what? We are focusing in all the systemic problem. Okay, when come to the ear, we go for a hearing test, we go for clinical examination, all that, which I didn't mention here because it's very complicated and confusing. Okay, then if we go more further, we have to focus on the brain, isn't it? So we have to do all the clinical tests again to test the central function. On top of that, we may need a scan, MRI scan to look into the brain to make sure there's no space occupying lesion in the brain, like tumors, or some things we call vestibular neuroma. The vestibule again, because of the nerve, neuroma means the nerve get a tumor that it may compress on the delivery of the information, blocking the information from the ear to the brain. Okay, so it can be due to tumor, it can be due to inflammation. You see, they're causing the vertigo.
Okay,
Okay.
so in short, doctor, I just want to say the message here is that if you have vertigo, no matter it's a brief one or recurrent one, we advise you go to see ENT specialist to get a further diagnosis, right? So because vertigo could be due to many causes, and then it could also leads to link to other. Vertigo is just a symptoms. It can actually indicate that probably the person is having some brain tumor or whatever more serious diseases. So all this we can leave to the ENT to have a further investigation. Of course, sometimes doctors will also refer to an audiologist for the hearing test. And then as what doctor you mentioned just now, you would like to see whether the person with vertigo symptoms having normal hearing or not so that you can make a better diagnosis to rule out something, right? But over here, just a message to all of you who are watching this live. If you are having normal hearing, but you never done hearing test before, we do encourage you also do the hearing test so that we can have your baseline result. And if let's say so happen you are having vertigo and you are going to see Dr. Gan, Dr. Gan refer you to us. we can tell that comparing your normal hearing result, the baseline, and the current latest when you are having vertigo, whether there is a differences. A lot of time, even an audiologist, because the awareness of people is not doing the hearing test, so we really cannot tell. Even with a 29 years old boy come to, I mean the guy come to us, we found that the person is having mild hearing loss at high frequency. We cannot tell whether this hearing loss is happening where is it because of the vertigo that only happened or even before that, right or not, doctor?
Yes. Okay. Just something to add on to a person with vertigo. You see what like Alia saying is like the management is not only a doctor can manage everything from A to Z. You see, it's a multidisciplinary treatment and management. You see, this also involve the therapist. For example, the physiotherapist. Okay, the like what Alia, the audiologist, the ENT, what other doctors may involve, the emergency physician. Okay, the neurologist, the brain. The neurologist may involve the vision. Okay, it can be involved of the eye, the ophthalmologist as well. Okay, yeah, I saw it. Is the BPP, is the vertigo happen only in the elders? Can it happen in the young people or not? Yes, of course, of course.
Yeah.
But the common age is 30 to 50 years old. Okay, 30 to 50 years old is the commonest uh, uh, presentation incidents. Okay, but it can happen in young. As young, I seen actually as young as like 6 years old. I seen a 6 years old vertigo. But
Wow.
if for the vertigo, if fall within this normal range, means on a 30 to 50 years old, you're not so worried, okay? Because this is a common presentation age. Of course, you need to worry as in you need to identify to confirm what is the diagnosis. But if it happened in the young age or the elders, yeah, there's another red flag, okay, another warning signs. If it's a young age, we really have to find out. Do you remember or not when you were young, you like to spin yourself and get the vertigo? Ooh, then you will fall to your one side, right?
Yeah, I still
Yes,
remember I like to go, there is a what to say,
yeah, the merry-go-round or something,
then I just turn myself, self-turn myself, then sing, or sometimes on the rotary chair, the chair I can rotate.
See,
Yeah.
but if a child come to you say, "Mommy, I'm very dizzy," something
Mm,
wrong. Okay, something wrong, because kids like spin. I don't know why. Maybe in the wombs when they are in the mums, wombs, they are floating. You see in the air. That's why maybe they like that kind of sensation. I don't know. I don't know.
yeah,
Okay.
correct.
So if a child telling their parents they are dizzy, something wrong. Okay, something wrong. Okay,
Okay.
including the elders. You heard a lot of people with the vertigo in the elderly, which is wrong. Usually the vertigo happen in the young age, I mean the 30 to 50 years old. If they are very old, then you have to look at again the definition of vertigo. Is it the elders really really spin on itself or not? Okay,
All right.
or just a sense of imbalance? That is how we differentiate a true vertigo or a non-vertigo. Okay.
Yeah. So over
This
here,
is
I will just display again. Vertigo is a symptoms rather than a condition, and it's a sensation that you or the environment around you is moving or spinning. So this is a definition of the vertigo. So if let's say it's not this definition, meaning to say that the person may not have the true vertigo, but it's more like something looks like
something else.
something
It,
else. Maybe it's a
it,
dizziness or giddiness. Yeah, all right. So,
it
doctor,
can be due to emotion as well.
okay, yeah, emotion, correct. So I think now, just now, doctor, we have covered how ENT diagnose vertigo, and then you also covered the impact of vertigo. Like for example, the possible impact that there is something wrong with our brain and all this, right? So how about the impact of vertigo in our daily life? Can you just briefly tell our audience here?
If the audience have a history of or experience of vertigo, then they will know how disastrous is that. Okay.
Yeah.
This really, I have a patient, a pregnant lady, with a vertigo and also with hearing loss attack during the early of the pregnancy, which I can't do anything because most of the medication is not safe for the babies. And that's how I feel the mothers is really wonderful. they can suffer for months until they deliver with this kind of spinning, tinnitus, reduced hearing, and refuse any treatment because for the babies. Okay, so can you imagine? I let you spin for about 5 minutes. Do you want it? My goodness. Also, the impact. So you can imagine how bad is that. And there is another mothers who already delivered, but is breastfeeding her child. Okay, came with a very bad vertigo, the infection of the organ we call labyrinthitis. Okay. Labyrinthitis, the treatment we need to give steroid. We need to, really stabilize the patient. You see, with all the
Correct.
medication like vestibular sedative, all that. The first question come up from their mouth. Her mouth is, "Doctor, is it safe for my child or not? Because I'm breastfeeding." So all this impact is really bad. So another question, another things that the information to you. This vestibular organs is hidden very deep inside our mastoid, the skull bone. And in fact, that bone is the hardest bone in our body. So, so can you understand how important the balance organ to us, right? So the impact of these organs go dysfunction to our life, our daily activities, our lifestyle, everything is really a huge, huge impact. Okay, but very good things about, okay, now the incidence is always in the third to fifth decades. This is
Yes.
considered still young, isn't it? Yeah. So
Yes.
our brain, our
It's
brain is
also fall into my range also. I also fall into this range. Too bad.
so our brain is actually can adjust. We can adapt to that kind of condition. Okay. Now come to a more deeper definition of vertigo. When the information, right ear, left ear, the organs, they fire the identical, is the same information to the brain. Say you close your eye, you turn your head 30 degree to the right. The right ear will say turn to the right. The left ear also will tell you turn to the right, 30 degree. If let's say the right ear say, you are turning 30 degree to the right. But the left ear say, no, 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 you are turning 20 degree to the right.
There's a confusion.
Yes, the brain will get confused. That is when you will start spinning again. Woo, vertigo. Okay, and this vertigo will move you towards the right side. You see, towards to the weaker side. Okay, to the left side. All right. So this kind of spinning vertigo. So if you understand that, so we need to adapt. Our brain will use our eye, our position, our sense of position to compensate this kind of imbalance. But in reality, everyone, I would say every single one, maybe including me, if I'm having a vertigo, when the vertigo attack, what the first thing you do? You will close your eyes.
Yeah.
You will close
So
your eyes. You don't want to see, you don't want to see. But that will make the vertigo even worse.
okay.
You
So
understand or
the
not?
actual fact is that they should actually fix to one point, use their
Correct.
eyes stationary to look at it that one point, right, doctor?
Yes.
They are
A
using the
lot of
eye
people,
cross the learn about that, the VOR, something
the
like that.
VOR, the vestibular ocular reflex. Okay,
Yeah.
so when you are fixing in one point, you are basically like telling your brain, hello, buddy, please stop spinning. I'm stable. Okay, I'm stable. With that kind of fixation, if this is due to peripheral vertigo, it will cool down, it will slow down. Okay, it may actually disappear as well, but it depends on the duration. I see. It's not like when you fix, then you straight away it disappear. Okay, no magic in the world. Okay, so but at least when you focus, it will cool down and slow down the vertigo, and it will just fade away. All right.
Yeah.
Open the eyes and fix in one point. Not open the eye and looking left, right, up, down, and keep looking surrounding. That will cause more confusion, okay, to the brain. All right. Yeah. So the when come to the management part of the vertigo, of course, if I'm not talking about medication, just like let's say it happen when you are driving, so what are you going to do?
Yep.
I'm not asking you to focus in the front, but you still continue driving. Please don't do that. Okay, you have to secure yourself. Okay, you have to maybe put aside the car, okay, or you sit down, or even you lie down, you see. So you secure yourself, then you open your eyes, then you focus in one point. Okay. Yeah. So come to the diet or the lifestyle. Okay. Salt restricted diet. Usually we restrict the salt. Okay. Nowadays a lot of people like to eat tasty food, right? The tasty food usually a lot of ajinomoto lah, the salt, even the sugars, all that, you see. All this is actually can induce inflammation. It can cause edema, mean the swelling, okay, puffiness in the organs inside, okay, especially through in the Meniere's disease, okay.
Doctor, I suddenly have one question. Does this eating salty food like Ajinomoto also affect tinnitus?
Tinnitus is another topic. We talk about it later on, okay.
Yeah. Sound like we'll do another tinnitus series lah. So stay tuned. If let's say some of you who who like Sound Life Facebook Live, because we are doing this Facebook Live from time to time, feel free to actually follow us and then share this video to your friends. Especially when they have this vertigo attack, because we are very fortunate to have Dr. Gan sit here today to talk about vertigo for almost like an hour already, and then still not ending yet. Yeah, so we are very fortunate to have Dr. Gan on board here. So please share our live, and then later you are having the chance to actually get like 100 ringgit free hearing test voucher to be done in Sound Life. Okay, and then feel free to also follow our page, and not only just follow, but follow and not only just like, sorry, need to like and follow, because now our Facebook setting is very smart. If you just like, you cannot see our notification. Only when you like and follow and put as a priority, then you can see when we are doing the Facebook Live. Okay, doctor, sorry for the short advertisement. You can continue. And also Columbia Asia as well.
So actually nowadays a lot of people, I mean, when up to this stage lah, okay, our life, people really want to know how to treat vertigo, how to
And how to
manage it
prevent as
if
well.
we have a vertigo. So just now briefly I already told you, not everything's medication. So if you have vertigo attack once maybe in a while, say about 2-3 years, one attack like that, are you going to take the medicine for 2 or 3 years? No, right? Or during the attack, you take the medicine. Without the attack, you stop the medicine, right? So all this actually depends on the type of the vertigo, type of the disease that causing the vertigo. All right, that will decide what medicine you are taking, and whether you need a long-term medication or not. Okay, this also depends on the severity. But when it comes to the acute management, like you are having a vertigo now, so what are you going to do? As what I told you, please don't close your eyes. Okay, secure yourself. Okay, in a safe condition. Okay, to prevent falling or accident happen. Then opens your eye, focus in one point. If this is due to peripheral vertigo, means due to the organs that not related to the brain, the vertigo will get better and better. It will fade away. What if this vertigo persists? Then you should worry. Okay, why? It can be related to the brain, stroke, all that. There is some insult in the brain. How to resolve the vertigo just fixing the eye, right? So it doesn't make sense. If this is persisting vertigo, even though you did what I say, fixing in one point, but the vertigo persists, something wrong. This is another red flag, the warning sign to you. So you should go to the hospital. Okay, when come to the diet, say the salt restricted diet. The second one is exercise. Do you think nowadays we exercise a lot? If I ask you to exercise 10 minutes in a day, I think a lot of people also cannot achieve that, you see. So exercise is another. Why exercise is important? Again and again. Vertigo. Why vertigo? Earlier, remember the vertigo, when I first say vertigo is not only the ear issue. It can be the vision, it can be due to the position, it can be due to the bone, it can be due to the muscle. So with a strong muscle, with a strong bone, then you can control your body balance better. Okay. So that actually plays an important role. Okay. for the vertigo management. But people with vertigo, I tell you, they will just lie on the bed, watching the YouTube, watching a handphone, or just sleep. During the acute attack, I don't want you to fall down. I'm not forcing you to walk around when you're having the acute vertigo, but
Correct.
for the treatment to recover, you see, some people the vertigo can last for days. Some can be just very brief, like BPPV, maybe just few seconds it disappear. But those more serious one, it lasts for days. They shouldn't just lie on the bed and lying and sleeping. They should do some exercise. Even on the bed also they can do exercise, isn't it? Exercise doesn't mean that you have to go to swimming or what, or go and jogging or what. No, you can just do some muscle stretching even on the bed, isn't it? So exercise. Again,
Okay.
now talking about sleep, isn't it? So you must have a regular sleep, more regular daily routine. This is like telling your brain, to try to condition them to more routine, you see, rather than you can sleep anytime, you see, but not like that. Sleep, regular sleep is important. Allergy control. Allergy control. You see, allergy, for people's perception, allergy must be having rashes, itchiness, you know. Then sometimes anaphylaxis, like wow, shortness of breath. No, actually, there are some allergies. It's very trivial. You see, it's very mild. It's not really like causing any symptoms on sometimes. This is especially true because we saw a lot of, like, we done, ENT, we done a lot of allergy tests. Not all the allergy tests, the severity is 5 or 6 category. Some can be 1 or 2 or 3, where the patient also don't know the allergy to this thing. Okay, that kind of allergy. All right. So vestibular rehab. Yeah, vestibular rehab. This come to the physiotherapist. This is how, for vertigo, the main treatment is all this lifestyle modification. It's more important than the medication per se. Okay, medication is mainly for acute condition, like acute, during the acute attack, we try to suppress our vestibular organs to cool them down. Yes, we use a medicine. All right. Vomiting, vomit, like, So we have to control the vomiting. This vomiting with the vertigo causing vomiting, all this is because of the central. There's one place in our brain that can trigger the vomiting because of the imbalance. Okay, that's why imbalance vomit. Even like you boat sick, you're sitting on a boat, or even like the in the car sick, all that also it can cause this kind of vomiting or vertigo, right? So vestibular rehab is the main thing. Medication to control acute condition to cool you down, but the rehab is one type of the physiotherapy. This is important to gain back our balance. Okay, and this rehab, if you learn, there are so many other activities that you can, okay, to control, to retrain your balance organ back to normal. And I found this is interesting also. You see, elders always with this kind of imbalance, but those who always exercise, for example, go for the qigong,
Yeah.
qigong exercise. Qigong, actually, there is a very important part of the treatment you see for vertigo, though, or preventive. Okay, it can be preventive. If you
Yeah.
do this kind of exercise,
Preventive, right?
you are trying to trigger the balance organs, to keep them active rather than keep lying down. If they are active, usually they will function well. Like a car, so if you stop the cars, parking the car for 1 month, then you start driving, you may hear some cracking sound here and there, isn't it? But if you drive every day, the car will be smooth. Something like that, you need to trigger the organs, you keep always exercise to maintain. Okay, this is what we call central compensation. In case you have vertigo, can be preventive as well. To keep the muscle and the joint strength, the breathing exercise together with the balance organ, head movement, all that. Okay.
Doctor, I do practice qigong. Even though I think that normally you say that qigong is for elderly, right? But for myself, I also practice qigong, and I find that it's very useful. And I have learned from one qigong master. According to him, even for those that are very weak, there is also certain qigong, especially the breathing exercise, can be done by those like even for bedridden patients. So yeah, it's very good to have some exercise, or qigong is also a good way as a preventive for vertigo. Yeah.
Yeah.
So
Or
doctor,
some sort of exercise lah. Some sort of exercise that
yeah.
keep you move around, Yeah.
Okay. Thank you, Dr. Gan, for your sharing. I think people here are getting a very clear understanding, especially for those who have vertigo. Like, for example, here we have Minesveri. I mentioned thank you to Dr. Gan, very informative, and I have a clear picture on finding the treatment for my mama. So I think today's Dr. Gan really share a very good tips for people who haven't got vertigo and but you understand how vertigo happen and what are the causes, what's the differences between the peripheral vertigo and the central vertigo, as well as how an ENT actually do different tests, like for example blood test, hearing test, what else, doctor? Sorry, I forgot already.
The
And
radiological, for example, like the scan,
the
you see,
liver scan or whatever to find out the real true root
migraine.
cause for to cause this vertigo. Because if let's say it's a central, then it's very how to say dangerous, because we are not sure whether is it related to stroke also. So another thing is also over here, doctor. I know that the time is very late already,
Yeah.
but can you just
Yes.
spare another 10 minutes because there is some questions from the audience that we haven't really answered. So I will just pick a few one. Okay. Maggie Sin have asked that will neck cause vertigo? Neck pain will cause vertigo.
Okay. Neck pain. Why neck pain can cause vertigo? Okay. Neck pain, again, neck pain. The neck pain can be due to the muscle pain, or whether it's a bone problems, or the joint, the vertebra. Okay. Okay. There is a huge blood vessels. Okay, going from our heart, go from the vertebra, go to our brain. Okay, it supply the high brain together with the small brain. Okay,
Mm-hmm.
but also to the ear. All right. So blood vessels. When neck pain, usually it won't cause vertigo per se. All right.
Mm-hmm.
If especially if it's due to muscle, it's just a muscle weakness. Again and again and again. Vertigo is not the only problem of the ear. It can be due to the ear, the
The ear,
eye,
the
the
eye.
brain, the muscle, the bones, right?
Yeah.
So if you understand all this, okay, maybe I should rephrase my, my statement again. It's not vertigo per se. It's a sense of imbalance, okay? But a true vertigo is always from the ear or from the brain. Okay, that general statement I think will make people clear, isn't it? So, if again, look more specifically into these questions, whether the neck pain can cause vertigo or not, the answer is no.
Mm.
Unlikely, like I would say, unlikely. Okay, if the neck pain is due to the muscle, no, it won't cause vertigo. I mean, it maybe cause a sense of imbalance, disequilibrium, all that. Uh, but if it's due to the bone or the disc, then it compress on the blood vessels, okay, to reduce the blood supply to the organs. This is especially when you're like looking up, okay, or looking to the side. This may compress, the blood vessel may get compressed. Then it can cause a sudden reduction of the blood supply to that part of the organ that is supplied, for example, the ear, the balance organ. It can give you sometimes something like you lost balance for a while like that. Okay, but these kind of things, it will very quickly get back to normal. All right. So I hope I answer your questions.
Yep, Dr. Gan, very clear. So the answer is no. Yeah, and then some other may cause imbalance, lah. May cause imbalance. Okay. So doctor, we also have someone. I also interesting to know about this. Why sometimes people vomit during the vertigo and sometimes they don't. So how to prevent vomiting? I think vomit
Remember,
is really something very how to say.
remember just now actually I mentioned just now
Yeah,
if you I actually mentioned about the vertigo causing the vomiting. Okay, this
yeah,
is something that related inside. You know, in our brain, a lot of wire on, all sorts of circuits, all the highway here and there, all the connection. Okay, there is
Correct.
one connection from the balance organ to the chemoreceptor trigger zones. Means the zone that actually trigger the vomiting.
Okay.
Yeah, it's just there is a connection there. That's why when you have a tiger, you may just vomit. Okay, how to control that? We cannot block the transmission of the information, right? How to block? So specifically, that things usually we can't. We can control by medicine. Okay,
Mm,
the anti-emetic medicine. Okay, it can be centrally acting anti-emetic medicine, for example, like Kytril. This medicine is actually to block the central to prevent you from vomiting. Okay,
mm,
usually can be controlled by medication.
mm,
Again, if you just focus what I said, stabilize yourself, focus
mm,
in one point, don't panic. Again, panic, emotional can trigger and worsen the vertigo. You see,
mm,
now you see everything is related to each other. I
mm,
hope that it won't confuse you. But at least you don't panic, you take a deep breath, okay, right?
mm,
Then you cool down yourself. You focus in one point. That kind of cooling down the vertigo will reduce the firing of the nerve to this vomiting center that cause you vomit.
mm,
You see, so again, how to control the vomiting? So put it more simple, medication.
mm,
Okay, if
mm.
not, control by yourself. Means you focus. Okay, you stabilize
Bring
yourself.
the best
Don't get
back.
panic. Don't get panic. Don't move
Yeah,
around your head, left, right, and up, down, including your vision. No. Take a deep
yeah.
breath, cool yourself down.
Okay.
When that happens, your vertigo also will reduce in case
Mm,
of if this is due to the peripheral
mm.
vertigo.
Okay. All right. So I think now it's very late. Thank you, Dr.
Yes.
Gan, for your answering the audience questions. I know that there is some more other questions coming in. However, our time is very I mean now it's very too late for sleep already. So for those who miss out, like for example, certain people, Isaac asked about vertigo happened to the young one or old one, you may actually rewatch the earlier part because Dr. Gan have shown the statistic as well. And then when is the best time to do PPV exercise? I think this one may be best to refer back to physiotherapists, right, doctor? So to me, exercise actually there is no time frame lah. By right, if let's say a person having some diseases, if you want to strengthen, if you have more time, you should do more. All right. So that's all for tonight. Thank you again. Thanks again, Dr. Gan. And for those who haven't liked and share our page, please share our page. So over here, I would like to just spend some time to see that who is actually the person most share, and then later on we will actually find out um, from the chat, and then we will comment, and then we will let you know if let's say you are our winners for tonight. So for those who have any hearing problem, feel free to actually look for us, Soundlife Hearing. You can always find us in the SS2, and then over here is our contact number whereby you can call in as well. And then that's all for tonight. Okay.
Yeah.
Oh, one more thing. Yes, Dr. Gan, you have something to say?
For your information, actually, for the balance, yeah, physiotherapy is doing the good job. Other than that, the audiologists as well. Some audiologists they even train in doing the balance. Okay,
Yeah.
yeah. Aliyah will have one, right? Aliyah, you will have one
Correct,
session with
correct.
this audiologist.
So I also
Good
wanted
point.
to take this chance to also promoting. Actually, Sound Life is doing a few live, and then tomorrow night we are inviting Dr. Shasha, the principal audiologist from Yetistic Hearing and Balance, to share with us. She is actually well trained in the US curriculum to manage Okay, sorry. Let me rephrase. She's actually specialized in vestibular management. So not all the audiologists handle balance disorder in Malaysia, but we do have certain audiologists who have a special certificate to handle all these problems, whereby they will use a certain equipment, like for example, WAM, to do more detailed diagnosis. So later I will share the flyer over here, and for those who like our Vertigo Facebook Live series, feel free to also subscribe to our Soundlife page, and also follow our page, and stay tuned for our tomorrow night Facebook Live with Dr. Shasha. Okay, thank you so much again, Dr. Gan.
Thank you.
Thank you
Thank you.
for having your night with us tonight. So that's all for tonight. Thank you so much, everyone. Bye bye.
Bye. I hope my presentations give a lot of information, then to not confuse you further, so you have a clear pictures about what is Vertigo.
Yeah,
Okay. Hope this really
correct.
helps. Okay. Thank you, everyone, and good night.
Good night. Bye bye.
Bye.